All right. And welcome everyone to our last session this week of Northeast Florida Indicators Data Review. We are gonna today explore the healthcare, and behavioral health section of the Beaches dashboard. I'm going to go through some of the data that we're seeing at the beach and just chat a little bit about the enhancements that were made um, to the dashboard since the last time we worked together. My name is Allison Owenby. I am the Vice President of Data Research and Strategic Initiatives at the Nonprofit Center, and I'm joined by Lacey Lambert. She is our Rena Coughlin Research Fellow. And I know we have two folks that are joining the meeting that are in their car, so we won't ask you all to introduce yourselves since we kind of got your names at the beginning of the meeting. Um, but I do want to just jump right into the data. So let me pull that up and I'll share my screen. We can walk through it together. All right, here we go. We are going to, this website you see here is the Beaches Action Collaborative website. This website is for our partners in data, the Beaches Action Collaborative. They are a organization that brings together businesses, citizens, and faith-based organizations as well as nonprofits at the beach um, to bring them together to collaborate. We partner with them and host sessions, and then you can also access our dashboard here. This is the Catalyst website. So Catalyst Northeast Florida is the nonprofit center's larger data initiative. And if you scroll down to the North Florida Beaches website, data site here, you can navigate over to the North Florida Beaches Indicators site. So I'm going to today talk a little bit about physical health, mental health, and healthcare. This is the last of the 5 meetings that we're had this week. The week started with economic vitality. On the economic vitality front, we talked a lot about economic disparities at the beach, what the labor market and data around the labor market is showing us, how people commute and get around at the beach. Um, on Tuesday, we talked about education. So we talked a lot about the amount of young people that live at the beach and how that's on the decline, at least for very young children. Some outcome measures of school performance at the beach, as well as the overwhelming fact that beach residents are very highly educated, right? So a lot of them have bachelor's degrees as well as master's degrees, and how that kind of compares to other parts of our community. And then on Wednesday, we talked about food insecurity and how food access is something that all parts of our community should be focused on, um, especially for children and especially for seniors. We talked about the average cost of a meal and how that continues to rise throughout our community. So right now, the average cost of a meal in Duval County is $3.74, and St. Johns County is $4.34, and how that has risen pretty significantly over time, but took a little bit of a dip more recently based on the latest data we have available. This was from 2023. But today we're here to talk about physical health, mental health, and health care. And we just added a new section to the dashboard around health correlations. So we're not just looking at one set of data, but how two different sets of data interact with each other and overlap. So I'm excited to be able to share that with you all today. So the first section we're going to dive into is physical health. So we're going to ask the question, how physically healthy are people that live at the beach, right? So the first section we're going to review is around chronic disease and poor physical health. So when you look at the data, You're going to see overwhelmingly that the beach outperforms Duval County in most areas except cancer. So when we look at obesity, you'll see the percentage of folks at the beach that are obese are is lower. Diagnosed diabetes is lower. Coronary heart disease is lower. Asthma is lower. Cancer is higher, so this doesn't include skin cancer, but overall cancer rates are higher at the beach. Chronic obstructive pulmonary disease lower, stroke lower, high blood pressure, cholesterol is actually a little bit higher, just about 1 percentage point. And then teeth loss among adults is pretty significantly lower. So we're looking at 8.8% versus 14.6. And so we measure this and then overall physical health. So when we're measuring, we define poor physical health as physically unhealthy days. It's one of the CDC's health-related quality of life measures. It's defined as a person's perceived physical health over time, and physically unhealthy days asked about the number of days in the past 30 days a respondent experienced poor physical health because of physical illness or injury. And if they categorize them as being in poor physical health, it was defined as they said there were 14 days or more where they were feeling physically unhealthy, right? So I want to make sure we call that out before we dig deeper into this data set. And so we see here that, again, the beach is quote unquote healthier than Duval County, where people at the beach reported 10%, almost 11% of people at the beach reported feeling poor physical health. Um, and then this is kind of where those folks are located from a mapping perspective. So we can see different parts of the beach and their physical health rates. So we can see Atlantic Beach and north of that area has a pretty low percentage of physical health, whereas some of these other areas on the other side of the intercoastal have higher rates, so up to 14.4%, 14.9. This is actually east of the intercoastal. We are looking at Naval Station, Ribault here for this area. Dutton Island is right here. And this is Atlantic Boulevard. So it's right north of Atlantic Boulevard. There's a pocket of pretty poor physical health. Ooh, what's happening here? Sorry, guys. I don't know what happened to that website. Here we go. And then if we go down to Ponte Vedra, there's another pocket of poor physical health. Um, this is going to be right across from TPC Sawgrass. This is Ponte Vedra Palm Valley School, so right across from that area. When we are going to look at health behaviors here now, so when we think about poor physical health, that's an outcome of choices that people make throughout their life when it comes to healthy behaviors, right? So these are leading indicators of people's health, things that they can do in advance in order to prevent kind of poor health outcomes. So we see here that and at the beach, right, people are more likely to have had a checkup in the past year. People are overwhelmingly more likely to have been to the dentist in the past year. And then people are less likely to be considered a regular smoker. They're more likely to be a binge drinker, and they are less likely to report having no physical or leisure time, no physical activity or leisure time, and are less likely to report that get 7 or less hours of sleep. I think this is also an interesting statistic about life expectancy at birth. So, life expectancy at birth is a new statistic we just added to the dashboard after our last set of sessions. This is going to tell us the average amount of life people are expected to live when they're born. So, when we look at life expectancy at birth, the beach has a much longer life expectancy. You could almost round that up to about 80. Duval County overall's life expectancy is 76 and Florida is 78. So the beach is outperforming even Florida when it comes to life expectancy. And when we look here, you can see how life expectancy varies by where you live or where you're born, right? So we can see parts of Ponte Vedra have 84, as well as we have another pocket over here of 84. And then the lower amounts, up by Mayport is around 72 life expectancy, uh, 74, which would be west of the intercoastal. And there's a few pockets in here that don't have data that they could aggregate back to. But as you scroll across the map, you can see how that life expectancy changes based on where you're born. This section of the dashboard talks about screening and early detection. So are folks at the beach and part of our community getting screening done more often? And overwhelmingly, again, yes. So we have higher rates of mammography among women age 50 to 70. This kind of shows where the highest rates of people getting mammograms live. This shows us that also women at the beach are more likely to get a annual pap smear or pap smear um, within the previous 3 years. So this is not an annual data point, it's within the past 3 years, which I think is the recommendation now if you're not predisposed to cervical cancer. And again, this map just shows where the highest rates of pap smear exist. And then this also talks about colorectal screening. And again, everyone at the beach is more likely to have had a colorectal screening. So here we have some of the highest rates at the darkest black colors, and lighter gray indicate lower rates of screening. Now I want to talk a little bit about mental health, and we have two statistics or two groupings of data we're going to talk about when it comes to mental health. Um, One is the suicide rate. Now, suicide rate I can't break down for the beach specifically, but I did pull in numbers from St. John's and Duval County. So our suicide rate is higher in Duval than it is for St. John's. So we have 17.7 deaths versus 14. Lacey, can you make a note to add some verbiage above the suicide rate to kind of define what that is and help?
Sure.
Thank you. I forgot to update that. And then these are some mental health rates additionally. So when we think about the beach, we're going to compare that again to Duval County. We're going to see that less people at the beach are reporting poor mental health. Less people, well, almost similarly, have been diagnosed with depression when we compare the beach to Duval County. Um, there are less adults that are feeling socially isolated, and there are less adults that are sharing that they lack social and emotional support. This kind of just shows at the beach where the rate of poor mental health and how that's changed over time. And you can see, when they started collecting data for this in 2014, the rate was 12.8%, and now we're up to about 15.6%. And you could attribute that to any number of items. You know, uh, just increased awareness about mental health and diagnoses and things like that. But it'll be interesting to dig deeper into that and see if there's any other underlying causes. Also, this shows diagnosed depression and how that has changed at the beach. And you can see some slight fluctuations here. So we were at 20%, down to 19, up to about 21, and now down to about 19 again, based on 2023 data. All right, the next section here is around health correlations. So the power of our tool is really based upon looking at individual data points, but also we are able to see kind of how two of those different data points overlap. And so we're going to look at physical health. We're going to look at life expectancy and mental health rates as well as some uninsured, how those two items interact. So when we look at the beach, each one of these points on this graph is a census tract. And so they're plotted to show how where poor physically health people, poor physical health and poor mental health intersect. So we were able to form so it says here, as poor physical health among adults increases, poor mental health among adults also increases. We were able to find a zero point 0.4 strong correlation between the two. Well, a moderate positive relationship between the two variables. But anybody who knows anything about health, there are so many different factors that go into being able to correlate two different variables around health that though this is a moderate correlation when thinking about health, overwhelmingly, this is considered a pretty strong correlation. So this is a map here where we're mapping poor physical health and poor mental health and where those two things overlap. And so if I was building a program that wanted to target people who had poor physical health and poor mental health, like maybe building a healthcare clinic, I would think about serving people in these areas, right? So this is, again, uh, near Mayport. We've got this area right across the intercoastal. We've got this area, kind of a pocket within Ponte Vedra that could be focused on that have high rates of both of those percentages. The next correlational chart is looking at physical health and life expectancy. So again, each of these dots is a census tract at the beach, and we're showing that there is a moderate negative relationship here between the two variables. So as poor physical health increases, life expectancy decreases, right? So if you're have less health throughout your life, you're probably going to live less. And we were able to kind of show this through statistical modeling for the beaches community. Now, again, this is another bivariate map where we're looking at where poor physical health and life expectancy overlap. And so what's interesting to look at is that there's not any black on this map. There's some dark brown and there's some dark blue, but there's not a really geographic concentration of where these two data points very severely overlap. You could say that some of these areas here are where those overlap the most, but not quite that strong black indicator that we saw in the last map. This one is around poor mental health and life expectancy. And so again, these are all of our census tracts, but this one we found a very strong correlation. So this is a 0.76 correlation where we're looking at poor mental health among adults increases, life expectancy at birth decreases. So poor physical health was correlated with life expectancy, but not nearly as strongly as poor mental health, which I think is really interesting. And again, this is where the mapping feature comes in, where we can see how those variables interact with each other. This one is poor physical health and number of uninsured residents. So we can see there is a 0.48 correlation with this, and we're showing that as poor physical health among adults increases, those people are also likely to not have insurance. And this is kind of where those two data points overlap. You can see a pretty dark percentage here of those data points overlapping. And then the last correlational chart is around poor mental health and number of uninsured residents. And so this is showing an even stronger correlation. So it's interesting when we think about mental health and both of those having stronger correlations than the physical health aspects of them. So this one has a 0.59 correlation, showing a moderate positive relationship between the two. So as poor mental health among adults increases, insurance rates also increase. All right. And then the last data point I'm going to talk about today is around healthcare access, um, and what health insurance rates look like at the beach. So over here we have the Beaches Action Collaborative is showing a 93% of folks within their community having health insurance versus Duval County's 98%. And so these are kind of the opposite percentages there. This is kind of the hard numbers. So about 103,000 residents have health insurance versus 7,899 that don't. And then this graph shows us where those uninsured folks are living. So a lot of the darker colors you see are on the other side of the intercoastal, with some other higher dark grays right here where kind of Mayport is. There's about 700 right by, I think this is Beach Boulevard. Let's see. Yep, Beach Boulevard here. This is another view by zip code. So we can see majority of folks living in 32225 zip code or 32250. This graph kind of breaks down uninsured by age. So here we're looking at there's not too many kids under the age of 6 who are uninsured, 305. We've got 1,500 kids aged 6 to 18 reporting as uninsured. The majority of folks are between age 19 and 64, and then a few that are 65 and older, which is concerning just because um, of Medicare, Medicaid that could cover those folks. And then this data point here shows some data around local health providers and the number of healthcare providers that are based at the beach. Their offices are based there. So the last time we got into a really interesting conversation about this, and folks were questioning this data source. Um, and afterwards, I was reflecting on the conversation, and the folks were under the assumption that Mayo Clinic was included within this footprint. But as I was reflecting on the conversation, I realized that Mayo Clinic is outside of this geographic footprint and is not included. And so maybe um, that's why some of the numbers seemed low, right? So we're looking at right here a count of 112 primary care physicians, a count of 194 mental health care providers, which is quite high, um, 86 dentists, 42 pediatricians, and at the low end, we have 6 geriatric care providers. And then we added in some maps that just kind of show where the concentration of those type of doctors are. So we have one for primary care and one for pediatric care as well. And that's all the data that I have for you all today to talk about. Um, Again, I appreciate you all joining on this Friday. That's a busy Friday when it comes to kind of all the things that are going on within the week. I appreciate you all joining, especially Donna and Suzanne, for multiple sessions this week when we have been reviewing lots of data around the beaches community. And I would invite you all to join us on May 19th for our larger data convening at the beach. We'll have it at Jacksonville Beach City Hall. And during that session, we'll talk a lot about how, from a macro level, these data points are all interacting, what they're telling us about the community as a whole, and gather some stories to kind of reinforce what we're seeing through individual interactions. Any thoughts or feedback about the data you saw today? Lacey, what do you think?
What do I think about? It's
Yes,
very
you.
interesting. I don't know much about the beaches, but it's interesting about the healthcare providers, and there's less geriatric ones. I thought was interesting since the aging population is older over there. So
Hmm. Agreed. Yeah, I think the biggest takeaway for me was doing some of the correlational analysis with the um, mental health data. And I thought that was really interesting that we were able to find statistically significant relationships between mental health and uninsured residents, as well as mental health and life expectancy. Um, thank you, Suzanne.
This is Donna.
Hi, Donna.
I'm in a place where I can talk a little bit.
Oh, good.
I just I was surprised when I first heard the cancer rates and of being higher at the beach, but then as you went through the correlation between that and then the higher number of people that are getting uh, mammograms, all the testing,
Mm-hmm.
um, makes sense. Now they're being diagnosed. Uh,
Right.
so that didn't alarm me as much as what I was expecting. Um, and is there a way that that Mayo Clinic area can be included in this? That was really surprising to me. Now, that was because there's that Mayo Clinic area is also where Cypress Village is,
Mm-hmm.
and all of those, there are separate healthcare facilities and senior care facilities in that area as well.
Mm.
Um, and they're building, does it, and I'm not looking at the map, but does it
Sure.
include up San Pablo where there's a lot of new housing and construction in that area?
So, yes.
That goes up to Beach Boulevard.
So it cuts across the geographic breakdown cuts across San Pablo Parkway. And so
Okay.
anything to the
East.
east of San Pablo Parkway is included. Anything to the west is not. So I'm looking at the map right now.
Oh,
It doesn't include Hodges. So, we could change the map to have it go up to Hodges if that's something. But yes, Cypress Village Senior Living is excluded,
yeah.
as well
Plus,
as like Pablo Creek, parts of Pablo Creek Reserve.
yeah, down there, and
Hmm.
also going north up to there are new apartments and new there's a whole new townhome community and everything there. There's not a lot of commercial until you get up
Hmm.
to Beach Boulevard, but that's
Yes.
interesting to, I don't know. I mean, we sort of look, if we look, well, I don't know.
Yes.
Because for example, where Palms is located,
Hmm.
we're directly east of that area.
Right.
So we consider our service area to be, Ponte Vedra all the way up to Mayport and then west. And we'll look as far over as almost to 295, just because there are
Right.
pockets in there too of
Hmm.
poverty that are in there, and I don't think we're picking all that area up in this either. But
Yeah.
if that's what the back chose, that and I'm not I'm not in a quote leadership role in the back, so
Hmm.
um I don't
Yeah.
know, but it's just
I think it's
interesting.
I agree. I think there could be an argument made that we at least bring the geographic footprint over to Hodges Boulevard and cut
Yeah,
it off there, and then
yeah.
also include the area of parts of what did I say that part was?
Pablo Creek.
Pablo Creek. Yes, Pablo
Yeah,
Creek
because that
Reserve.
yeah, because that area, I mean, there's a lot of wealth over there.
Hmm.
Um, so I don't know, but because that's still when you come across the intracoastal and then go south, coming from the beach, go across the intracoastal and go
Hmm.
south, which is where your Pablo Creek. Um, there's a whole pocket in there that's still Duval County.
Right.
Yeah. And I
Hmm.
don't know how far in that goes. I'd have to look at a map, but just something to think about. But thank you so much for your time. I really do appreciate this.
Oh, you're so welcome. Anytime. We
Okay,
appreciate you
I'm
joining.
no, well, I'm going to turn off my microphone now.
Yeah, no, thank you, Donna.
Thanks. Okay,
You're,
take care.
you're welcome. All right. I think that's all we have for you all today. Again appreciate you all joining us and for the conversation, and I look forward to seeing you all soon. Thank you so much. Happy Easter. Happy Passover. Bye.